Just want to make sure you know that we are being recorded. So welcome. Today our focus is on professional development, and I'm excited to get to that topic. So let's talk about what we're going to do today. I'll share some updates from CSSP. We usually have updates from the National Alliance of Children's Trust and Prevention Funds, but I will actually just share a brief update from them. And then we'll jump into a fishbowl style conversation with leaders from around the country who are experienced in professional development in various fields. And they'll be talking about their experiences and their insights. And when it's a fishbowl conversation, what we mean by that is that we hope they'll be as if we were all in a room together and they were in the center of the room having this conversation, but the rest of us can look in and watch and listen and then jump in at times. So if you want to jump in on one of the questions they're answering, you'll be able to do that either by typing into the question box and we'll read it aloud, or if you want to raise your hand in the webinar panel, I can unmute you so that you'll be able to speak. So that's what our plan is for today. I'm going to talk a little bit about these webinars themselves, especially since we have a lot of new people joining us who haven't been on these webinars in the past. These are our monthly Strengthening Families Networking webinars. We invite those who are using the Protective Factors Framework and coordinating Strengthening Families efforts. We recently expanded from previously we would just invite folks who were leading these efforts at the state level or involved in intensive community work, and now we've opened that up to a wider list. So we're excited that many new people are joining us. We convene this jointly. I'm from the Center for the Study of Social Policy, and we do this with our colleagues from the National Alliance of Children's Trust and Prevention Funds. The topics and guest speakers each month are coordinated either by CSSP or by the Alliance, or for the first time this month by a volunteer from the Strengthening Families National Network. So we're excited that in the coming months we have a nice rotation of led by one of the organizations or led by a volunteer from the network. As I mentioned, this is being recorded. These recordings and other materials are posted on a site maintained by the Alliance. We also will be putting them up on our website, but this is one solid URL you can always use to access those recordings. And it's a nice archive of all the past webinars as well. I'm going to share a few webinar tips from GoToWebinar for those of you who may be newer to using this technology. On the right side of your screen, there's an attendee control panel, and one of the options there is audio. So there you can indicate whether you're using your telephone or the mic and speakers on your computer. If you're on your phone, there are some tips here about how to avoid static and how to hear best. I think the two most important things here are if you're having a sound quality issue, try hanging up and dialing back in. That sometimes resolves the problem. And to use the audio pin shown on your screen so that the system connects your online connection with your voice connection. And that's the way that I'll be able to unmute you. You'll be able to raise your hand and things like that. If you're using the voice over internet protocol, which is the mic and speakers option, and you're having any audio problems, you may need to check your speaker setup, check your volume, and if it's still not working, then do try calling in, and clicking on that button to say you're calling in will bring up the phone number that you need to dial. If you have any questions, you can type them in the question panel, and we'll try to help you resolve those issues. I want to make sure that you all know we do have a webinar every month. We normally do it on the second Thursday of the month. You'll note today is the first Thursday of June, but that's because next week is the Community-Based Child Abuse Prevention Grantees meeting, which has a large overlap with who participates in these calls. So we wanted to avoid that conflict, so we moved it to this week. Our upcoming ones I'm excited about. In July, we're going to hear about strengthening families and corrections. Roger Sherman from Idaho is coordinating that. And we'll be hearing about what they're doing in Idaho and Vermont and in Washington, all states where the correctional system has embraced the Protective Factors Framework in various ways. You can register for that now at the link that's on your screen, but that will also be sent out in the next e-update newsletter. So you might just want to note it in your calendar now and then register when that newsletter comes out. On August 13th, we'll be talking about CSSP's work, not just strengthening families, but other work that we do about young children and their families. And on September 10th, we'll be talking about a protective factors approach to supporting foster and resource parents. And that's coordinated by a volunteer, Kate Beejan from Rhode Island, and others who have been part of our working group on implementing strengthening families and child welfare. So those are some of the exciting topics coming up. Hope you'll be able to join us. With that, I'm going to officially start giving the updates from CSSP. Now I finally reveal who I am. I'm Kailen O'Connor from the Center for the Study of Social Policy. And the main thing I want to talk about today is some tools that we just released. We're calling it a toolkit for child welfare practitioners. It's posted on our website and was announced in the newsletter that went out last week. I'm going to show you where you can find it on the website, because I know sometimes people struggle a little bit to make their way through our website. So from strengtheningfamilies.net, you would click on Practice, and then under Practice, it's the expander called Aligning Practice with Strengthening Families. Scroll down through a couple other tools, including, well, a lot of other things, and then you get to Practice Tools for Child Welfare. So we're very excited that these are up. They were developed in partnership with some of the jurisdictions that have been doing really intense work on how to implement strengthening families in child welfare systems, and lots of iterations and lots of feedback to make them relevant for a lot of different systems to use, and we hope that you will find them relevant as well. So there's a set of practice tools for workers, and then there's a supervisor's coaching tool. I'm going to talk about each of those really briefly here. Excuse me. The first tool is actually called Strengthening Families and Child Welfare Practice Skills. And that goes through how strengthening families relates to the skills related to each of these areas of child welfare practice. We call it the practice wheel. A lot of jurisdictions have their own practice wheels, and this is sort of a hybrid that we created to represent the basic areas that are included in a lot of different practice wheels. So the first handout that's on the website there is just looking at how strengthening families relates to each of those and can contribute to your work in each of those areas. And then we have specific tools that relate to some of these parts of the practice wheel. So for engaging and assessing, we have a tool called Using Protective Factors to Find Relevant Strengths. That's set up with some information and then a worksheet, basically a blank form that you can fill in. It even has a spot to indicate the worker name, the family name, and the date in case you want to really fill it out for a family and put it in their case file. But we always encourage people to just use it in whatever way makes sense, and perhaps there are forms in your jurisdiction that you could incorporate this information into, and we would fully support that rather than adding one extra sheet of paper. The next one is Strengthening Families and Teaming, where we talk about different types of team meetings, family team decision-making meetings, and how the protective factors play in for each of those. When it comes to planning, we have a worksheet called Using Protective Factors to Develop Case Plans. It goes through developing some sample tasks and activities for a case plan, and then again has a form that you could use that you really could put into a family's file, or that you might just be able to incorporate some of these ideas into whatever case planning form you already use. For intervening, we have another called Building Protective Factors During Casework Visits. That's a lot of examples of things you might do and conversations you might have with a parent during a casework visit related to each of the protective factors. And then finally, one called Using Protective Factors as a Lens to Monitor Progress Toward Case Closure. And that really gets to some core questions about what kind of changes do we want to see in parents and in families as they're moving towards case closure. We initially were talking about this just as something to use at the point of case closure, but some jurisdictions said, no, we're going to use this from the beginning so that families know sort of what we're thinking about, what kinds of big picture changes we want to see, and that it is strength-based, wanting to share this with judges for them to understand the kinds of progress we want to see in families. So we used it as that, we reworked it to be more about monitoring progress that you could use at any time during a case. In addition to those tools for workers, we have a supervisor's coaching tool. This is integrated, so it includes both Strengthening Families and Youth Thrive, so that supervisors can use it with their workers regardless of the age of the child that this worker is working with. It starts with a general coaching worksheet about how you might make sure that a worker is using a protective factors framework once they've received the training in it, sort of making sure that they're thinking about how to apply it. And then for each protective factor, it goes through some of the worker skills you would look for, what to look for in case plans, some of the ongoing activities the worker might be doing with families and youth, and some suggested coaching activities. This is designed to be used in a supervisory meeting where You could either be looking at a specific case and talking about what's going on with that family or that youth, and talking about each of the protective factors. It could also be used in a more general sense, just to sort of check in with a worker about how they're integrating this into their work. So we are very excited about these tools. The jurisdictions that have been using them have reported back positive results, and really workers are quite happy with them, and we hope that others will be able to use them now too. One other update I wanted to share from Strengthening Families is that we recently developed a Strengthening Families Speakers Registry. So this is, I get a fair number of phone calls and emails of people saying, oh, we're doing a conference on this, on protective factors or on ACEs, and we want a speaker about protective factors, or we have our state leadership team strategic meeting. We want a speaker who's used the protective factors in policy work a lot. And I'm, trying to make those connections to help people find the right people who could come speak, whether it's within their state or someone from another state. But I thought it might be useful to just let you all tell each other what you're able to talk about. So we have now this list. It's organized by state, showing where people indicated their own areas of expertise and that gave their contact information. I want to emphasize that we didn't vet this list. We didn't create this list. People were able to enter themselves on it. We had some states where 20 people registered themselves and some where none did, but hopefully over time we'll get more in each state so that there's some more options there. We are making that available by request. So if you are looking for a speaker or you just want to see the list, send me an email and I'll send it to you. And if you'd like to add yourself to the list, I would actually probably send you the Word document and have you add yourself onto it, and then I will make that my new version. So please do contact me if you're interested in that, and I hope this will facilitate more sharing across states and within states. I do have one update from our colleagues at the National Alliance of Children's Trust Funds. They are not with us on the webinar today because they are in Atlanta offering a training of trainers for their for their curriculum that's called Bringing the Protective Factors Framework to Life in Your Work. They have a really good group there. They got a couple pictures yesterday of people who are attending, and they're doing their second day of training today. So you may recognize some of these faces. I know I do. And we're excited that they have such a good representation of states there, and that training continues to be used all around the country in some really great ways. So hello from our friends at the Alliance in Atlanta, and they'll be with us on the next webinar. Okay, that's actually all the updates we have to share today, a little shorter than usual since the Alliance isn't with us. So we're going to jump right into our main topic of the day, which is professional development and the different strategies that folks are using. I'm going to introduce Jessica Shugrue, who was our first brave volunteer from the National Network to coordinate one of these webinars. She's done a great job of thinking through the questions and pulling together good speakers, and she's going to facilitate the conversation today. Jessica is a co-Strengthening Families State Lead for New Hampshire. She's a child care training specialist in the Child Development Bureau for the state of New Hampshire, and I'm going to let her take it from here. Jessica, are you there? It's possible that Jessica is on mute. Let's see. Okay, I'm not able to hear Jessica right now, which is odd because I could hear her before we started. I think what I'll do is go ahead and introduce our other speakers and hope that Jessica can jump back in. Let's see. All right, let's go into our other speakers. Brenda Kinsler is with us from the City of Philadelphia's Department of Human Services. She's their director for family team conferences and has been very involved in implementing strengthening families in their child welfare system, including doing and coordinating a lot of training. Thank you, Brenda, for being with us.
Hello, everyone.
All right, we can hear Brenda. Barbara Levitt is with us. She's a Community Impact Director at United Way of Utah County. She's also one of the trainers for the Alliance's curriculum on bringing the Protective Factors Framework to life in your work. And she's been very influential as a co-state lead in Utah. Barbara, do you want to say hello?
Yes. Hello. Thank you.
Thank you. Okay. Karen Chinaski is with us. She's a partnership project manager at the Center for Schools and Communities for Pennsylvania, and she is one of the state leads for Strengthening Families in Pennsylvania. And you'll note we have both Philadelphia as a city and Pennsylvania as a state represented. They've all been working on these Strengthening Families and taking some different strategies and some working together. So Karen, can you say hello?
Hi, it's great to be here today. Thank you.
All right, thank you. And Michelleroop is with us from New Jersey. She's the project director in the New Jersey Department of Children and Families in their Division of Child Protection and Permanency. She's been very involved in rolling out a lot of Strengthening Families training there. And yeah, Michelle, do you want to say hello?
Hi, everybody from New Jersey.
All right, thank you. Now, let's see if we can hear Jessica. Oh boy. I'm thinking, Jessica, perhaps, because I know you can hear us, I'm going to just try muting you and then unmuting you. The magic of on and off. Can we hear you now?
Hi, everybody.
Oh my gosh, it worked. All right. Thank you very much.
Plan.
All right. Well, we worked with it. So yeah, I'll hand it over to you now. Thank you so much.
Thank you. And I think you did a much more fabulous job of introducing everybody than I would have. So I was getting a little nervous about the last name. Well, good afternoon, everyone. And it's my pleasure to be the guinea pig on hosting the first webinar. So hopefully, we can have a great conversation this afternoon. I know that we've put together some wonderful national partners in our Strengthening Families work to consider these questions around professional development. And in fact, I'm going to be traveling to New Orleans tomorrow, and this is one of the major topics of the NAEYC National Professional Development Institute this year is workforce and professional development. So one of the first questions that we have today before us is, what current professional development activities does your state engage in around strengthening families' work? And I would like to see if I could get Barbara Levitt to jump in on this question, because she had some interesting insights that she could share with us this afternoon.
I'm here. Okay.
Okay.
Sorry, I muted myself and then couldn't find how to unmute. We currently, in our state, we had the opportunity of hosting the Training of Trainers June 2013. And during that training, we had a team of administrators from child welfare that were trained to implement the protective factors in a training into our 4E waiver in-home program. And so that has been ongoing for the last 2 years, and they were very actively involved in developing many, many materials. I love the new materials that Kailen just talked about also that will add to the richness of that. But then also at that same time, we had 5 basically multidisciplinary community providers that were trained, and I was one of those. And at that time, we were working on embedding protective factors into multiple systems. And so we were able to present and to reinforce the importance of the training across sectors and community-wide. And so as a result of that, we've been not only able to train many, many different disciplines within early childhood, but we have also been able to train many community providers that they're not usually brought to the table. And another thing that we implemented with this training is we have asked individuals to bring parents to the table also, and to have those parents involved in those trainings so that we get that perspective when we are doing the training. The other thing that I wanted to share also was that we have had many community providers that have come forward and have asked for unusual ways for us to train, and I want to discuss that a little more in some of the further questions, but that has also, I think, been a wonderful thing that's happened in our state. Being a community provider and a community-based organization at United Way, I'm thrilled to see this training kind of moving out into unusual areas of the community. So.
Well, that's a great example, Barbara, of cross-sector work and really capitalizing on some of the resources that you have. And I know that United Way here in New Hampshire has, and some of them have actually adopted the Strengthening Families framework into their allocations review process, asking programs how they're utilizing it. So there's definitely going to be a continued need for that professional development. Do any of the other panelists have any insights into this first question that they'd like to share?
So this is Brenda from Philadelphia. So in Philadelphia, we have, under our Improving Outcomes for Children initiative, community umbrella agencies, and they are now the community providers of child welfare services on the back end for families in Philadelphia. And so we have trained the Strengthening Families coordinators in those CUAs, we call them CUAs, as well as the extended community, because part of IOC is that they branch out in the community and keep the services in the community. Additionally, on the parenting side, DHS partners with PHMC, Philadelphia Health Management Corporation, to oversee parenting programs across the city. And those parent educators are also trained in the Strengthening Families framework and actually have implemented the language into the evaluation tools that they use for overseeing these programs. We have actually branched out into the Department of Behavioral Health so that they're trained in the Strengthening Families framework as well. And we're actually looking to include the health profession in that training so that they too are familiar at least with the language and the protective factors. The education component, the school district in Philadelphia, we have not trained the school district to the extent that we want to, but we do have the Education Support Center, which is part of DHS in Philadelphia, and they are trained in the protective factors. And so we're continuing to push this work out in Philadelphia, primarily through the Strengthening Families coordinators in the CUAs, of which there are 10 throughout Philadelphia. And they have done tremendous work with continuing to train. They are the trainers, and they can train at will to community organizations, to community partners and stakeholders, as well as case managers in their individual CUAs.
Wow, that's a great example of also in parent engagement piece and parent professional development. That's one of the areas that we are hoping to take to the next step here in New Hampshire. Do any of the other panelists have anything they'd like to share about their work in their state before I open it up to webinar attendees?
Sure, this is Karen from Pennsylvania, and just building on what the previous two people talked about, we also at a state level are looking at delivering professional development in cross systems, across as many systems as possible, and as local as possible. And we're doing that in a couple different ways. One is using a basic Strengthening Families sort of 101 presentation, introducing people to the protective factors framework at statewide and regional conferences. And then we also in Pennsylvania in May 2014, it's been a year, also participated in the Bringing the Protective Factors to Life in Your Work instructors training. And so we have several certified instructors here in Pennsylvania, and we're offering those courses primarily as series, and also some of the courses as standalone, within the context of a conference or as a way of introducing a potential group of people to think about taking the whole series. And we are working with departments of health, with visiting nurses, with child care agencies, with family centers, with home visitors, with all kinds of different providers throughout the state. And we're finding that agencies are saying, gee, we'd like to take on this series as a professional development activity for a year, and so there's a once a month course that's offered, or we'd like to do this a little more quickly, so they do 2 courses and then next month 2 more courses, and so on. So there are lots of different ways that it's being delivered through the state.
Yeah, I think that's the cross sector is really key and into getting the messaging out there. And I think once people understand the protective factors and the everyday actions behind them, it helps it to transcend beyond just the usual suspects. Does anyone that's joined us on the call have any insights around professional development activities that their state engages in that they would like to share? Okay.
Yeah,
well, if anyone thinks that, go ahead.
We don't have any hands raised at this point. And so if you want to raise your hand or type in a question, please do. Oh, it actually looks like Shirley Pitts has raised her hand. I'm going to unmute her. Shirley, are you there?
Yes, I am. Thank you. I just want to share that something new that we're doing for the first time ever. This is sort of a practice for us since we're, geographically so diverse, and what we tried this first time, now we've just finished it up, is working with a group called the Trust Training Cooperative, and it's really our mental health trust that provides long-distance training for behavioral health workers around the state. So we just did our first 5-week session long distance, and we had video conferencing then in 5 different locations around the state. So that was the first for us.
Yeah, I think you definitely have to get creative around the methodologies and platforms for learning now, and there's so many tools at our disposal. So it's nice to hear all the different methods that we're getting the information out. So why don't we now transition into the second question is, how is the professional development delivered? What are some of the strengths in the current methods, and what are some of the challenges? And one of the things I'll do I'll ask one of our panelists to start us off with this question. So I'm going to ask Chinaski to jump in if she has anything to share about this question.
Sure, thanks. As I mentioned, we do have a group of certified instructors, and then I guess I wanted to try to explain a little bit about why I'm representing some of the other talented folks here in Pennsylvania. Our Strengthening Families leadership team has grown out of our Children's Trust Fund board, and its commitment to strengthening families' protective factors framework going back a couple years, and asking all the Children's Trust Fund grantees to embed the protective factors in their work, and then more and more of the systems that fund services in Pennsylvania, the Office of Child Development and Early Learning, the Office of Children, Youth, and Families, through the Department of Human Services, the Department of Health, and so on, are highly recommending, if not mandating, that people include the Strengthening Families Protective Factors framework and demonstrate how this is a part of their work. And so we are delivering professional development, as I said, through presentations at conferences, through webinars, a lot of different ways to touch people and to get them using some of the same language. With the protective factors, with the bringing the protective factors to life in your work, the center where I'm employed is working as sort of the point of contact, and then we are contacting different instructors, basically geographically, to ask if they can take on a series or a particular course. And we are collecting the attendance sheets and the that we then pass on to the National Alliance as part of being a certified bringing in protective factors to life in your work instructor. And we're finding that system is working. We're able to adapt to the different needs of the participants, and our instructors bring a wide variety of experience. When we do the shorter sort of workshops or presentations, the Strengthening Families 101 at broader conferences or regional meetings, it serves as an advertisement for the longer series. We've been able to have people allocate time through their existing work world, and one of the challenges that we're facing here is that not everybody's going to be able to continue to do that, and so we're sort of struggling with whether we will have to develop a fee for service for this work, and how would that work. And so that's something for us to consider in the next year to 18 months.
Yes, I know that sometimes capacity can definitely be an issue. Do any of the other panelists have any suggestions regarding how they've met some of those challenges, or would like to share some of the strengths in their current professional development delivery system?
Hi, this is Michelle from New Jersey, and you know, we've faced similar challenges. One of the things that we did last year was to pool several funding sources. So we used like CBCAP funds, we had a project launch grant, and then we used state funding as well through the Department of Children and Families to do a train the trainer for 30 individuals, and we did the same thing cross-sector for child welfare, early childhood, and family support. And we're getting ready to do another train the trainers for another 30 individuals. This time the state of New Jersey is funding that. So we'll have a cadre of 60 certified trainers through the National Alliance by July 1st. And the way we deliver the training is it's basically on a regional basis, and we open it to child welfare, early childhood, and family support partners free of charge. And we're planning a statewide rollout. Right now we're just in Essex County, where Newark is a large urban area, and we've trained about 400 individuals so far. But by the end of this year, we're thinking we're going to have trained as many as 12 to 1,600. And then next year would probably be double that.
Wow, that's impressive. Any other panel?
I was just going to add, amazing how quickly the numbers grow.
Yes.
Yeah. So in Philadelphia, I think that the opportunity to have staff at our disposal was built into the IOC initiative. And I think that the CUAs having Strengthening Families coordinators to each CUA really helped us be able to train those staff who could then train other what they call auxiliary staff in each CUA. So they have at their disposal case managers and even auxiliary staff who they continually train the Strengthening Families Protective Factors framework to. Additionally, at DHS, initially we had a unit of parent educators called Parent Action Network, and they were the initial staff who trained and provided the technical assistance to the Strengthening Families coordinators in the CUA. And so we had an opportunity to start out through the initiative with staff who were trained in the protective factors work, and because DHS already had a central point with PAN, we were able to integrate the protective factors into the existing parent education realm, and they went out into the community previously and worked with families and with other systems around parent education. So we were able to sort of integrate, and we had the help of staff from CSSP to help us do that.
Yeah, that's great when you go ahead. Sorry.
Yeah, and so we've had the CSSP staff with us for the last 2 years with this initiative, helping us roll out the training for strengthening families, and additionally through DHSU, which is the training arm for Department of Human Services, we actually have the framework online so that staff who are trained in the framework and protective factors can go back at any time to the different modules and just reiterate to themselves what it is they might be deficient in, or it is there for them to do as refresher courses moving forward. And so it's also available to other parts of DHS, other staff with DHS. The Education Support Center, for example, has access to that same e-learning system. And so I think one of the challenges that could eventually happen is that continuing to make sure that the training out in the community, once it goes from the CUA to, say, other providers, is that the technical assistance is still there to ensure that it is the integrity of the model remains. And I think that's one of the concerns as we move this further out into the community.
Yes.
If I could pick up on that, one of the things that we did here in Pennsylvania in the broader community, I appreciate Brenda bringing that up about fidelity, is particularly with bringing the protective factors to life in your work. The National Alliance has been growing its body of work through the last 2 or 3 years, and has more slides and more alternatives for activities. Because we're spread out across the state, last spring after our instructors certification, we worked together to create the different modules using the National Alliance material, using some material from CSSP, and created presentations that all instructors can use. And a big part of that is to ensure the fidelity. Now, they each do it their own way, they each have their own spin, but we know that they're covering all of the key points. And additionally, we have evaluations for each one of the courses that helps us check to see if people, checks for understanding, are people getting this, and then what might they do with this work.
Right. That's great. Because I think it's important to be looking at it from that assessment perspective of, not only where are we going, but, where can we go further down the line. And I know in New Hampshire, we've worked a little bit like Philadelphia in that we've tried to build capacity into a system that we've already had in place through our Child Care Aware of New Hampshire by using those folks as our training and technical assistance specialists when it comes to strengthening families, by training them and keeping them up to date on all the latest developments. At this time, regarding this question, I wanted to give a chance for participants on the line with us to weigh in and provide any feedback or share any of their experiences.
So we don't have any questions typed in at this time. Nobody has their hand raised right now that I can see.
Sure. All right, so what I want to do then is I'm going to actually move over the promising practices question, and I'm going to move into the next opportunities, because we've been having so much fun that we have a short amount of time left. And I want to give time at the end for folks to have questions and that sort of thing. So I'm going to ask Brenda to think about our next question, which is, what opportunities do you see for future development and professional development activities in your state?
Well, I think that, primarily in Philadelphia, because I think Karen is doing a lot more work on the state level, but in Philadelphia, which actually has the ability to be somewhat autonomous in terms of how we roll out different initiatives. But what I see is the opportunity is certainly there, because we have partnered with other systems such as United Way, such as Health Federation, who does a lot of work in the early childhood realm, to actually train some of their educators in the Strengthening Families framework, and also ensure that they have that language in their practice as well. But because they partnered with so many other smaller community agencies and smaller partners in the community, I think that the opportunity to continue to develop ways of furthering this work is great in Philadelphia. Having it on the e-learning system modules for folks to access at will is also very helpful to us and a great opportunity. Continuing to train the community umbrella agency staff in strengthening families, because the work in Philadelphia is primarily going through them at this point. And so I think continuing to develop them in areas of the protective factors and exposing them to webinars, for example, to help them understand better how to implement this is a great opportunity.
Yeah. And this is Kailen. I just wanted to jump in because Brenda referred to the online training that Philadelphia DHS folks can use. And that's different from the Alliance's online training, which anyone can actually access for free, just because the Philadelphia one is very child welfare specific and it's very specific to their system. And, so all the language and tools and activities are tailored to the kind of situations that those workers are in. But I think in a lot of states and jurisdictions, you can make use of the online training that's available for anyone through the Alliance in a very similar way to what she's talking about, the sort of refreshing and bringing in new people and, letting people self-identify parts they want to learn more about after they've been to an in-person training. I think those are all great options, regardless of which online training you're using.
Mm-hmm. Right. No, I would have to say that I agree. And I know in New Hampshire we have taken that opportunity to utilize the online courses as a sort of an accompaniment tool to, specific trainings that we've also developed here in New Hampshire, and we've had great success with both utilization of both. But I like the e-learning model, and that's something we'll continue to hopefully explore as we move forward here. Are other panelists interested in providing some? I know, Barbara, you said you had some.
Yes, I would love to. Yes. One of the things that we're seeing with the integration of the electronic and the online training that's provided through the Alliance and also the live training is we're seeing time restraints all the time, and especially when we're trying to encourage the training of community providers or individuals who are at points of access where parents are. So sometimes that looks very different than just the standard traditional professionals in the early childhood arena. And so what we're finding is that we have, one, a potential career opportunity in our CCR&R system. We've been working on embedding this into the system where it has a live intro and wrap-up, and the actual protective factors are done online. That's one of the potentials and promising practices that we can see. But another one, or opportunities, but another one is we've developed some kind of teasers that we can go into a meeting and maybe give a 20-minute, very interesting kind of capturing of one protective factor and then drive them to the online system, and that's been a very effective too. And the third thing that we're seeing, and this is we're just kind of beginning this, and we've been doing it because of demand from those that we are training, we're starting to kind of set up the online and the in-person based upon the needs of that particular environment or particular organization. So this summer, we're actually training the statewide 211 system, and we're going to focus on the intro, which is always great in person, but then we're going to skip to concrete supports in times of need because that's their specific interest, and then drive them to the online for the other modules.
Okay. That sounds
cool. And your
cool.
211 system is, your 211 system is, in New Hampshire, we have a 211 system. It's like a database of resources for communities and families and.
Yeah, and it's actually call specialists that are on the line and answer those questions. Yep. Okay. So that's what we're. One other thing I wanted to add too, and I just would love to see this more and more, is we're asking whenever we go in to train an organization that they bring their parent leadership team to the training. And it's been incredible, the discussions that we've had at these trainings with the parents at the table.
I bet. Someone else was trying to jump in. I apologize. Okay.
If I could add to, I think it was Barbara's statement about bringing the parents to the table. Again, one of the wonderful things about the community umbrella agencies, they're required to have what we call community advisory boards, and those boards are made up of parents and community stakeholders, and they also have received the training, and the hope is that we will then be able to use parents to train other parents in different protective factors, and then continue to, again, push this work out. But Barbara's point, I think it was Barbara, about the engagement of the parents, that's an excellent opportunity to further help folks develop an understanding of what the factors are.
Yes. I think the parent involvement is going to be the key. Do any of the other participants on the call have anything they'd like to share about opportunities they see for future development in their Strengthening Families professional development activities?
This is Karen. I wanted to add that with parent involvement, one of the things we're doing, first of all, we want to really grow more. We're not doing enough yet. But one of the things we've done is invited leaders of parent type or parent advocacy organizations like the Title I parents from our Department of Ed and the PTA leader in the state and the parent organization that represents parents with children with special needs. And so we're trying to reach both local and individual parents, and also these sort of statewide and some of them nationally affiliated organizations, again, to build that language, that common language, and the understanding of working with families, not doing to families.
Right.
The other thing that I think some of this professional development with direct service staff is resulting is in the other work of our leadership team, which is impacting policy, not impacting practice is important, but impacting policy and systems. And so, people are asking, well, are we being supported by our organization? What can our organization do to be more supportive? And what kind of changes might we need to make within our organization? And so using some of the assessment tools and guiding and providing some technical assistance to organizations, I sort of see that as the next wave of work that might come up for us.
I agree, and I think in New Hampshire we're embarking on that as well. Kailen has some comments from one of our participants that she would like to read.
Yeah, so Vicki Longhofer in Washington State typed in a couple of things about some of the strategies that they're using. So one in Washington State is that for child care providers, a training module on strengthening families, as well as the completion of the self-assessment, is part of their early achievers quality rating and improvement system. And I think we see in I think we have 19 states that have in some way used strengthening families in their QRIS, and certainly that's one very systematic way to ensure that a lot of providers are getting training in it, and Washington has done that really well. And the other thing she mentioned was that they were able to do an all-day workshop at their infant and early childhood conference based on CSSP's report Branching Out and Reaching Deeper, which was the big report, sort of diving back into the newer research and talking about all the protective factors and the strengthening families approach. So that's really exciting. Vicki, I'm probably going to email you to hear more about how you guys did that, but that's really exciting to be able to do an all-day session at a statewide conference.
Yes, I would be interested in hearing more about that as well. So I know we're running short on time, but I wanted to invite Michelle, our other panelist on our group, about looking at this last question. And I know we'll end on a positive note, but we do have to address the issue of resistance and from training participants or system leaders about strengthening families trainings. And I don't know if Michelle had anything to offer about her experiences in her state with that.
I have a couple of things I could offer. One is around just the training itself, and what we found here was that we watched people would come in and look a little beleaguered and like, oh, this is another training that we were told to come to. But by the end of day 2, because we condensed the 3-day National Alliance training down to 2 days, people by the end of the day 2 were like really energized and positive. We ended with some of the community cafes and had excellent evaluations. I think what people told us they liked best was we did kind of a conference style with the training itself, and so people got to move around with groups of people they didn't know from other disciplines for 2 days, and they got to move. We did each of the protective factors with a different pair of trainers. So we had somebody from child welfare and someone from early childhood, and people really liked that format. I think our bigger concern, now that that training is done and the area we're trying to implement is around implementation, and then how will workers in all these systems be able to actually implement this in practice. And so we're working with Rutgers University right now to do an ongoing evaluation. So we're going to be touching base with everyone who went through the training at like 3-month intervals over the next year to see how things are going and what kind of barriers people are running into. The other thing we're doing is working with Rutgers University to put together a group conference, a guide for group conferencing that's like a coaching model for bringing teams together around specific families. Particularly in our interest right now is on families of infants and young children who are coming to the attention of Child Protective Services. And so, we know the frontline supervisor is really important in helping workers implement new skills. So we're trying to be really focused and disciplined, anticipating that we're going to, I don't know, it's so much as resistance as, it's great in theory, but now what does this really look like in practice? And I think the resistance, at least from the child welfare side, we're anticipating is this takes more time, particularly in investigations. And so, the argument I think that we're going to have to convince people is that an investment up front is going to pay off long term. And so we're just getting started on that. I'll let you know how it went down the road.
I'd love to hear about that. I think one of the things that's a shift for even our child welfare and even the family assistance groups that we successfully infiltrated child welfare because we're co-located in our child welfare agency, but I have met a little bit of resistance in family assistance, and I think it's because, you're used to working in a risk deficits model versus a strengths-based one, so they don't really see a lot of their place in some of this work. But I agree with you about it can be definitely capacity building. So we have about 9 minutes left. How are we doing, Kailen?
You guys are doing great. This is wonderful to listen to. I did want to say that Vicki typed in another comment about another potential area. So she said a small group of us is working on the potential for developing training in the protective factors with home visitors, with the main focus being on parental resilience and developing parent strengths in making choices. So that's an interesting sort of niche approach to developing a specific training for home visitors.
Yeah, I really like that concept of tailoring the protective factor to the service versus trying to get everyone to bite off the whole thing all at once. Do other panelists have thoughts about the resistance question?
So in Philadelphia, some of the resistance that we saw, again with the implementation of IOC, was like massive training for the community umbrella agency workers. And what I mean by that is they had to go through what we call charting the course, which is about a 3-month-long training series. And so until, along with CSSP, we were able to get the language into the curriculum. It was what we were doing was called a standalone at the end of all this training. And what we found is that people were kind of brain dead after 3 months of regulations and laws around child abuse and neglect and policy with DHS. So it sort of prompted us to really move the training into the CUA. And I had earlier talked about how the Strength and Families coordinators have the opportunity to provide those trainings on an as-needed basis. Some of the resistance that we were getting initially is that folks were just kind of tired of training. And so I think one of my other partners on the phone had said that people they didn't see the connection to the work that they were being told to do through the charting the course. They really couldn't make the connection of the protective factors and the framework in their work, although it is the guiding practice of IOC. So we found that when we moved it to the CUA, that folks were able to receive it better and could really understand it. And we really used a lot of the tools from CSSP in terms of we do a single case plan now, and so we were able to actually walk them through a single case plan. And so some of the resistance slowed down once we did not have it so closely connected to all of that massive training at the onset.
Okay. Yeah, that definitely makes sense. Thanks for sharing that. Karen, did you want to share something? And then I'm going to turn it back over to Kailen.
Sure. I was just going to say we often meet that same look that Michelle talked about when people are either volunteered for the training or they think, they know all about strengthening families. What are you going to tell me? It's sort of a challenge. And so we try to meet them with, yeah, you probably do. You probably know this. You probably do this. But what you might not be doing is doing your work with intention and with thinking about how are you intentionally working with a family to help them grow the protective factors, to grow based on where they have some strengths, to address where they have some needs, and help them be more well-rounded as a family to be able to sort of carry on for themselves without us as professionals. And that does tend to sort of tip the participation more to the side of the instructor when that's a message that's conveyed right from the beginning, and sort of a challenge too. So how will you more intentionally conduct yourself and make this approach a part of your practice?
Right. I definitely agree, and I always call it the "you're already doing it" phenomenon. We're just giving you a context to your work. But we have a few minutes left, so I just wanted to say thank you to the panelists. The whole hour flew by. There's a lot of rich discussion. I hope at some point we have an opportunity to pick it up again. But at this point, I want to turn it back over to our organizer, Kailen, and I just want to say thank you for all of my national leaders that joined me today to have this really important conversation.
Thank you all. This has been really a great conversation. It was wonderful to hear everything that you all shared, and I think, this is an ongoing conversation. I think anytime we get, a group of you together to have a conversation like this, whether it's about professional development or another topic around strengthening families implementation, there's just so much richness to what you're all doing, and I hope you all appreciate being able to connect with each other. What I have up here right now is just our contact information. It's mine and Martha Reeder, who wasn't actually with us today because she's doing the training of trainers in Atlanta. But we do coordinate these webinars, and we're always happy to hear from you. We are excited about the ones coming up, and we actually have a good lineup for the next 6 months of webinars. And once we start to get towards the end of that list, we'll be asking for volunteers to do like what Jessica did today so well, of facilitating a conversation, coordinating a topic. I thought it went really well, and I'm just so pleased. So thank you all the panelists, all you participants. It's been wonderful, and we will talk again in a month. Thanks, everyone.
Thank you.
Thank you. Bye.
Bye.